My name is Rachel, and my co-host Lindsay and I are two Psych NPs in a pod. Whether you're a current or a future psychiatric nurse practitioner, we are providing you a dose of support because it gets lonely out here. With practical tips, guest experts, and clinical gems from our combined 18 years of psych experience, we're here not only to share what we've learned over the years, but to connect with our peers who have a lot to teach us. Think of this as a conversation between two good friends who just happen to be Psych NPs and who want you to thrive. Pull up a seat, make sure you're cozy, and get ready to feel encouraged and to remember why you started. See you in the pod. Hello, and welcome back to another episode of Two Psych NPs in a Pod. I'm Rachel, joining you today from my home office in Milwaukee, Wisconsin. For those of you watching the video, I'm sure you can tell which Taylor Swift era I was last night at a Taylor Swift themed party. It's Evermore. And Lindsay is not here with me right now because she is on the way to Colorado and the service is a little bit rocky. So I'm just recording this to introduce part one of our interview with Dr. Debbie Granick. So today, in the part one of this interview, we're delving into a topic that's really close to Lindsay and I's hearts and really the essence of psychiatric nursing. That's the integration of therapy and medication. And no one could be better to guide us through this discussion than the incredible Dr. Debbie Granick. She's had a really remarkable journey starting her career in social work and public health and eventually pursuing a doctor of nursing practice to bridge the gap between therapy and medication for her patients. She has worked in a lot of different settings as a therapist, a social worker, and now as a nurse practitioner. And she really brings such a wealth of experience to the table. So in this episode, we explore her transition from therapist to Psych NP, various approaches she takes to mental health care, and the really interesting dynamics between clients seeking medication versus those seeking therapy, and emphasizing, the importance of offering a comprehensive range of options to help our clients. Whether you're a seasoned psychiatric nurse practitioner or you're just beginning your journey, this interview is going to resonate with a lot of us. So let's jump into the conversation. Debbie, we're so happy to have you on our podcast as our very first guest. And I know me and Lindsay view you as the GOAT of all things psychotherapy, and we know some things about you, but we want to know more about your journey, and for our listeners too, what your journey to becoming a Psych NP was like.
Thanks, and thanks for having me. And you guys are going to be the GOATs of bringing Psych NPs together into a pod. So that's great.
Yay.
I started out getting a joint master's degree fairly soon out of college. I think I'd been out for a couple of years in social work and public health. And I very specifically chose that combination because I had an interest in the one-on-one interaction, but also had a big interest in the greater public health, health education, health promotion, things like that. And I worked in that kind of combined field for a long time. I did substance abuse prevention, I did health education, health promotion, worked as a counselor in a school system, worked for 9 years with a hospital doing prenatal education, childbirth education. I got certified as a doula. I really enjoyed that part of my life and part of my journey. I also had 3 kids within 4.5 years in my 30s. And so that was a big piece of my journey also.
Yeah.
And then at some point when I was working as a social worker, there's a lot of pressure to differentiate ourselves, to find a niche. There's always that question, what population do you want to work with? What kind of therapy do you do? What kind of issues do you address? And I found that instead of a certain population of interest, what interested me was being able to provide more holistic care.
Mm-hmm.
And I was seeing people for therapy, but then needing to send them somewhere else for medication to augment their care with me. But I had this great relationship with them. And so that was kind of awkward. And often they had to wait a long time to get into care, or they were a population of people, teenagers, pregnant parenting women, who just didn't want to go to multiple appointments and things like that. So I went back to school, and I had done an accelerated bachelor's in nursing a few years before. And I started my journey of getting, a master's in nursing so I could prescribe. I worked with that degree for a while. And then I really wanted to go further and get my DNP because of my interest in being a thought leader and a clinical leader in this niche area of being able to integrate therapy and medication because I was finding it so effective, so interesting, so helpful to patients. Um, and so unique. There's obviously, therapists can't provide medication, and a lot of medication prescribers want to, but just don't feel confident or don't understand how to do that. And so that's kind of how I got to where I am. And now I practice clinically about part-time. Um, and I spend my other time really focused on coaching or course development in this area of helping my own colleagues feel confident and skilled providing therapy within their medication visits.
So I'm curious about what that was like for you as a therapist. Like you had already been practicing as a therapist under your LCSW licensure and seeing patients, and then you went and got an accelerated nursing degree, and then you went and got a master's in nursing. And like from that lens of a therapist, did anything strike you about like the
Mhm.
programs or the differences? How that
Well,
was?
very intimidating and scary. And I am now very comfortable telling people to lean into what completely freaks you out, if it appeals to you, if it intrigues you, to take that curiosity and let that lead you through what freaks you out. Because I had never had to do all that chemistry, anatomy, physiology. I truthfully never worked harder. I have 3 master's degrees, 2 bachelor's degrees, and a doctorate. My
Wow.
hardest education was my bachelor's in nursing.
Okay, that is so validating.
Yeah,
That's so validating. Did you guys
That
hear that?
that was the hardest piece. Yes.
it really
Um,
was. Yeah.
I also think that the power to hurt someone is really scary. And when you're prescribing medication, it's
Mhm.
really hard to put that aside, to find a way to not to put that aside in terms of not paying attention to it, but put that aside to be able to still just join with the patient and help them through this journey. Um, that was really scary and intimidating.
That's a
Yeah.
great
And
point. So you've been a therapist for how many years and a psych NP for how
I've
many
been a
years?
therapist since 1996, about 30 years,
wow.
and I've been a psych NP for 8 years.
Wow.
Mhm.
I'm curious in terms of what did you notice was different about how patients or clients would approach you as you kind of transitioned from the role of a therapist to now I'm doing both? Was there a significant change or not so much?
I think there is a difference because the clients who go seeking medication are open to that modality, and people who seek medication, I would say, are generally open to therapy, whereas I would see clients for therapy that may not have been open to medication. I know
Mm.
there are some clients who get medication who aren't open to therapy, but I probably don't personally see them too much just because they see my background and they know that's me. Um, so I would say that's the difference, is people who see in themselves maybe a need to access different modalities, different approaches to their own mental health care, and are really open and interested in that, which for me makes it really exciting because when people come through my door, I say, this is what I would encourage new grads to say to clients also. I'm skilled in medication management. That's a part of my education and training, but I also am skilled in psychotherapy, and I'm really willing and open to do both to help you reach your mental health goals. Or if at this point you really just want to focus on the medication piece, we can do that. And so I talk to my clients about that. I think for both the client and the provider, it's great if everyone's on the same page with what is happening in that visit and the expectations and the goals. So I do tend to put that out there at the beginning so that there's no questions. I'm not going to be confident providing some psychotherapy if I don't know the client is open to that. So I will say pretty much exactly that. I might say, we've talked today about your anxiety and how that's affected your life, and we've started you on a medication. And I do think that the medication will be really helpful to you. Therapy can also be really helpful for anxiety. I think it could be really valuable for you to have a therapist who you saw every week And I also could, if you're interested, integrate in some therapeutic approaches to helping you cope with the anxiety if you're open to both. Otherwise, I'm happy to just start with the medicine and you can wait on the therapy altogether. Or if you have a therapist and you're really comfortable and don't, really want a different therapeutic relationship, you can stay there with your therapy and we can just focus on the medication part.
Hmm.
You
I like
mentioned
that.
like the fear of prescribing, but what's been really interesting to me, I'm still pretty new in my nurse practitioner career. I graduated in 2020. But then what I realized talking to peers is that it really varies based on the program that you were in, like what scares you the most. And some people are like, they feel like real confident about prescribing, but they're terrified to say that they do therapy. They're terrified to say, oh, I can offer more than meds. And I've even heard some people say, like, I don't do psychotherapy, but I do talk therapy. And I'm
Mm-hmm.
like, okay, we have like a terminology issue where I think
Mhm.
it's so
Mm-hmm.
ambiguous for so many of us,
Mm-hmm.
also because there's so much variation in the programs.
Yes, there is. I generally use the definition of therapy is verbal interaction aimed at helping a person with their mental health concerns. So, yes, there is play therapy and speech therapy. We're not even talking about that because we're talking about add on psychotherapy or integrating psychotherapy. So, it's using verbal communication to help someone reach their mental health goals, using verbal communication to evaluate and manage a person's health condition, right? The add on psychotherapy is using that verbal interaction to help them make behavior changes or social interaction changes to reach their mental health goals. And so you're right, there is a language issue and there's a confidence issue, and that's okay. And I will say one thing I've learned to be more comfortable with over time is leaning into that with my clients and being really open and genuine with, I really believe psychotherapy could be helpful for you also. I am definitely not an expert in all things psychotherapy, but I do have some skills. And what I really have is an interest in helping you. And
Mm.
I would love to be able to partner with you to use some therapeutic skills to get you where I think you want to go. And if we get to where we feel like, hey, you kind of need more of this or more of that, let's recognize that together and help you get to where you need to be. And that kind of partnership is so, like, you can take a breath after that. You feel like you're not in it alone. And remembering that to heal someone, we don't want to always be in that expert chair. We can be very healing as a partner. And so
Mhm.
shared decision making, which is a super key word in documentation, and everything right now too, but shared decision making is really helpful for both the clients and for us too.
That's a
Remember, the client is the expert on themselves. The client is the expert on themselves. I say that 10 times a day still.
really valuable point because I think too, my experience has been that clients seem to trust their therapist more readily and
Mhm.
have a harder time really expressing what's going on to their prescribers. There seems like
Mhm.
there's kind of a power imbalance and this
Mhm.
expectation of, I think, with some prescribers feeling like, well, I need to be really confident. I need to be more directive. I remember hearing that my first year, actually, it's from a psychiatrist that she thought that perhaps I was coming off not as confident as I
Mhm.
should have been.
So, but look at insecurity as the investigator, not the judge. So instead of saying, I feel insecure, thus I'm bad, I must not be a good prescriber, I'm not skilled enough, be the investigator. I'm feeling insecure. What might that mean? Do I need more education, more consultation? So, and that phrase also has been really helpful for me, especially as a new grad. Be the investigator, not the judge. Stop judging myself for these feelings and instead ask myself, what is it I'm feeling and how would I respond to that if it was a friend saying that or something, right? If you
Yeah.
said to me, I'm feeling insecure about prescribing antipsychotics, I wouldn't say, well, clearly you're a dumbass. I would, right? I would say, well, maybe that's an area you want to get some more education on. Maybe that's a place you want to
Yeah.
do some more consultation.
Yeah, that's a great point. I think what was so difficult for me looking back at my grad school experience is I was getting so many like mixed messages, and there was so much ambiguity around like just what this identity was going to look like as a psych NP. And I already was kind of
Yes.
late in my own personal identity development.
Hmm.
And so I was also getting mixed messages from some of the people who were educating me and mentors, and that was just really confusing for me to know how to be.
Yes. But how can the entire field is ambiguous and we are within
Mhm.
that field. Every minute there's a new kind of branded psychotherapy.
Mhm.
There's EMDR, then there's this fast EMDR, there's CBT, then there's CBTI, there's PTSD, and then there's CPTSD. It's like the field is always changing. So we should have grace for ourselves on not always feeling the most competent and defined. And I would almost welcome that. It's good to not feel like super defined and rigid in a field that is always changing.
Hmm.
So
I
let's
like that.
have our goal be to be able to adapt and learn and grow, and feel confident that that is our role. Like our role is to be always feeling a little unsteady because that unsteadiness is what keeps us always seeking more education, more training, more collaboration, things like that.
There you have it. That was part one of our interview with our very special guest, Dr. Debbie Granick. We've got 3 parts total. So tune into the next episode where we actually do a bit of a mock therapy session with me as the patient. If you enjoyed this episode, don't forget to follow us on Spotify and join us on Instagram at the Psych NP Network. And as we wrap up, just remember whether you're navigating the challenges of prescribing or offering therapy, you're not alone in this journey. We're all learning and growing together. So until next time, take care, stay passionate, and keep tuning in to 2 Psych NPs in a Pod. Thanks for joining us. Bye.